Social media is becoming increasingly important in the health field. I think these days nobody can claim that you can live without social media. It's like you're telling me I can live without cell phone. It won't work. So I think we have to live with this new era, this is new way of communication, but we need to be aware about the pluses and minuses, the advantages and the inconvenience. And this is going to be addressed here during this ASH 2017 meeting in Atlanta through a sort of a social media session where I'm honored to be part of an expert panel in this field where we will tackle some of these hot issues or concerns that we are facing. I won't be able to go into all the details, but it's clear that social media is really accelerating the way we disseminate the knowledge, the interactions. I think for our patient, it's proving very highly effective. It allows for no border communication, which is really great, sharing information and so on. So a lot of advantages. However, we need to be aware that there are some dangers there, some inconvenience, because once it's in the social media, you cannot delete it. Let's say, for example, Twitter. Also, the short messages approach does not always allow you to explain your idea, to bring your arguments, so some misunderstanding can occur. So clearly you need to be aware of this. But at the end of the day, I think each healthcare professional needs to establish his or her own rules how to use social media. Definitely, I would invite everybody to embark on the social media. Twitter can be a good example, but I think one needs to follow his or her own path and define the frame. Why do I need to use it and how I want to use it? And then you stick to your own rules. But clearly, I think social media are bringing a lot of added value to the health system and to the medical community.